Now I said in the pharynx there are 3 of the 5 pharyngeal muscles you can see here. This one is the uvula. That's easy. Right there. There's the hard palate. You can see the bone. There's the soft palate. This is the palatine tonsil here, and that informs us because that means this ridge in front of that is the palatoglossal fold. That means that ridge behind it, right back there, is the palatopharyngeal fold. So that's what I was talking about. You can see the uvula, palatoglossus, palatopharyngeus. That's 3 of the 5 pharyngeal muscles. We don't see levator and tensor belli palatini on any of this. Okay? So that's how this relates to what we were talking about there.
So this part is the frontal sinus, and then the rest 3 are basically, one is this one, and one is this one, right?
For what? For the sinuses?
Yeah.
Well, let's back up for a minute. There are 4 paranasal sinuses. 2 of them are shown here, the frontal and the sphenoid sinus. We don't see the ethmoid sinuses, would have been here. And pass me that other model over there.
This one? Right.
That big one. Here, when you look at this one, the same thing. This is the frontal and the sphenoid sinuses. The ethmoid aren't shown here. They're the models. But then this view gives us these are the maxillary sinuses. This is the picture I just showed you here, right at the end. These are the maxillary. So on all these models, we can see 3 of the 4 paranasal sinuses. And then also, you got a bit of a deviated septum there. They showed here. There's the inferior concha. There's the middle concha right there that we see in the coronal section. Those are the concha.
Middle and superior?
Superior and middle, part of the ethmoid now. Here's the inferior concha there.
And then for this one, do we...
This one's a little less specific. It does show the frontal. If we match it up, it does show the frontal and the sphenoid sinus. Again, the ethmoid sinuses are gone. It shows us superior and a middle concha, part of the ethmoid. A little bit of an inferior concha there. It shows us the tonsil here, the palatine tonsil, but it doesn't really show very clearly the palatoglossal, palatopharyngeal fold. So I want to use like this one or that other one that we were doing. Yeah. The other thing we spoke about, this opening right here is the auditory tube, or the eustachian tube. Now, if you do a dissection, you dissect this out, that's where you'll get the tensor and levator belli palatini, but they're not shown on the model. Okay? All right, that's how some of this relates to what we spoke about. I'll point, you talk.
All right.
Okay? I already know this, presumably, so let's make sure you do. All right, openings right there.
Creamform
You
plate.
say something. Creamform plate, they're part of what bone we just spoke about?
Ethmoid.
Ethmoid. And what nerve goes through them?
First.
Olfactory, what number is it?
Number 1.
Okay, you will get questions from me that say identify the nerve, name and number. So be sure you're going to do that. We're going to keep practicing. So right there, and notice where it comes out. That, all the way through. What opening is that? Okay, that's the optic canal. What bone is it in? Sphenoid. What nerve goes through it? Say your nerve number.
2, 3.
Yeah, this is 1, that's 2. Then, we'll do this one. And we'll go right through that opening, right there. What is that opening? Remember, tucked right under the lesser wing of the sphenoid. You know what that is? No, we abbreviated it. 3 letters. Yep, SOF. 3 1/3 nerves go through it. Let's run them. What's the first one? We just took care of 1 and 2, so the next one must be,
Oculomotor.
okay, oculomotors, cranial nerve number 3. Okay, what does it do? It innervates what muscles?
Something with eye and letter.
Okay.
What is it?
It innervates 4 of the 6 extrinsic eye muscles, LR6, SO4, AO3. Okay. So, hedge your bets. If you don't know, say 3. Because it innervates 4 of the 6. Correct? Okay. Should we say them? Superior rectus. All right. Medial rectus. Inferior rectus. Inferior oblique. What's the other one? I missed it. Oh, is that 4 right there? I lost count. I'm sorry. Okay, that was the 4. All right. So that's cranial nerve number 3. What's next cranial nerve goes through the SOF?
Trochlear.
Okay, trochlear's number
4.
4. Innervates 1 muscle. What is it? It's inherent in the chemical formula.
Oh, SO4.
LR6 SO. SO stands for
Superior oblique.
superior oblique. What's the action of superior oblique? What does it make the eye do?
No, it's the opposite of the superior. So it will be going down. Making
Okay, put some terms in there, directional terms. It goes down, that's right, so it depresses the eye. What else does it do? What else does it do? Depresses and
lateral movement.
presses and abducts. The eye looks down and out. Superior oblique is a little bit counterintuitive, down and out. Okay, 3 1/3 nerves go through the SOF. You just handled 2 of them. You got 1 1/3 you left. So after 3, 4, what's next?
The 5-1, which is
V1.
B1.
Okay, V sub 1. Sensory only, motor only, mixed.
Sensory only.
What kind of sense, general or special?
General.
And general senses are?
Temperature.
Touch, pressure, things like that. All right, so we just handled the 3rd. Now what's the next one? 3, 4, V1, and?
Abducent.
Okay, what does abducent do? What muscle does it innervate, which is in our chemical formula again?
Is the last one, which is the L4SO3.
LR 6. What does LR stand for? Lateral rectus. What does lateral rectus do? What's the movement?
I don't know that.
Sure you do. Abducts the eye. And what's the nerve? Abducent. That's a nice little word association. Okay. Wrestle with this stuff. I'm actually trying to help you. Then you get into this next opening right there. What's that one?
Whatever. She's